Oh, you know the drill. Lots of us are grabbing shovels, heading outside. Doctors warn that cold weather can be especially tough on your heart when you do those kinds of things. Today, we're joined by Dr. Kardie Tobb, Cone Health cardiologist, clinical integration officer for Cone Health Center for Health Equity. And so, all right, I did it myself this weekend, Dr. Tobb. A lot of people are going to be shoveling their driveway or doing something like that. How does cold weather impact what we do and our heart?
Anya, thanks for having me. And same here, I did it myself this weekend with my family, my husband and kids, and coming from the north. But I will tell you one thing though, the cold weather really can impact your heart during these times when you're outside plowing your snow. So what usually really happens is you're out in the cold weather, your vessels constrict, meaning like you're squeezed together and your blood starts flowing and you're not getting enough blood. Because what happens now when you're not getting that, the blood pressure goes up, heart rate goes up, the oxygen that really follows through the blood starts to be reduced for the heart muscles. Then that's where comes the problem, the chest pain or the shortness of breath. And that's where people start experiencing that.
I mean, we're all, I think anytime you shovel a driveway, you feel a little like out of shape, right? It does take the wind out of you a little bit because it is hard work. But at what point should we know, hey, something's wrong here? What kind of symptoms should we watch out for that we say, okay, this is too much?
So think about this. Even people that we think are healthy and not exercising can have an issue when you just wake up and start doing something rigorous. So what I would say is start slow. When you start shoveling or pushing your snow, you start to experience deep breath, shortness of breath, meaning you start breathing out of the ordinary. You want to really slow down. Definitely, if you feel any type of chest discomfort, if it's tightness, squeezing, pressure, you really want to slow yourself down. Another symptom that people don't usually talk about is that lightheadedness. You start to feel lightheaded. Give yourself a break, relax, and don't overexert yourself because that could be slight symptoms that you're experiencing something from the heart.
Okay. All right. So heart disease, especially common in women. At what age should women make their heart health a priority?
You know, I get asked these questions all the time, and that's relevant. That's key insight for women. But what I usually say, I do key intersections in a woman's life. So I'll say when a young female start to transition from the pediatrician to their adult doctor, that is a key point. Adult from childhood, you should always be eating healthy, family traditions with things that are healthy. But that is a pivotal point in a female's life. So at that time, you start thinking about what are the tests that I can get? Is it checking my blood pressure? Is it looking at the cholesterol? What are the things? Am I diabetic if you're not type 1 diabetes? People that are overweight. So those are important times. Another time that is important again, think about because that transition is right there for college. So when you're graduated from college around 24, 25, let that be part of a graduation gift. And if you don't get there, you can, or you didn't go to college, when you're getting to your 25th birthday, you really want to make sure you've gotten these tests done that I've said earlier, blood pressure, cholesterol, diabetes check. Are you overweight? Are you smoking? Those things are where we start talking about heart disease prevention in women.
Yeah, it is really early on for sure. And if you're over the age of 25, you definitely should be getting those kinds of tests and screenings. So let's talk about some things that are unique to women that could increase their risk for heart disease that they might need to be aware of.
There are lots of things that we have traditional risk factors. We talked about these, the high blood pressure, the diabetes, smoking, overweight, sedentary lifestyle. But there are a few key things that are important for women. It starts from the younger years or the reproductive age years. So if a woman gets pregnant and have gestational hypertension, preeclampsia, they have diabetes during that time, or their babies were small for gestational rate, that is important for cardiovascular health in terms that that woman develop cardiovascular disease. Another part of this are women who have what we call polycystic ovarian syndrome. Most people will know it as PCOS. That is a cardiovascular risk marker because it causes cardiometabolic diseases, meaning that it causes truncal obesity, belly starts to expand, the hormones are mixed up, the blood sugar also goes up, causes people to have diabetes at an early age. The other thing that is not only to women, But what I want to say, the breast cancer treatment, women get breast cancer, disproportionately affect women, meaning more women get breast cancer, so we don't hear about the men part. The other one, people who have rheumatoid diseases, the inflammatory diseases, markers in women enhances their heart disease risk. So even if you don't have high blood pressure, diabetes, and high cholesterol, and you have those things, you want to really be careful and you want to talk about what is your risk for developing heart disease.
Okay, and when we're talking about like the screenings that would help, someone kind of figure that out, are we talking about like the cholesterol, the blood pressure, that kind of stuff? What other things might we be talking about?
So more things we can do now, and as we expand our knowledge, we're looking at it. Because one thing I want to step back and tell people, all we're talking about, 80% of these things really can help you prevent heart disease if you do these things right. So yes, the diabetes control, the blood pressure checking, and the cholesterol and things like that. There's something called lipoprotein A. It is a genetic marker that really will tell you or tell your family members your risk for developing not only heart disease, though, stroke, as well as valvular disease. Another thing that I always say, I'm sure some people who've heard me speak will say that I say this all the time. If you're getting your colonoscopy, if you're getting your mammogram, you want to stop and think about something called coronary calcium scoring. It's a CT scan, very low dose radiation. What we do, you don't even need to get an IV line to get that test done. It's done based on risk stratification. You don't have to have chest pain or shortness of breath to do that. What's important, if that score is 0, you're really at a minimal risk or low risk. Now, if you do have calcifications, that's when you start having conversations about how do I prevent further progression? How can I get targeted for my cholesterol and looking at my high blood pressure and things like that?
And I know that there are women at home who are like, I do not have time to make an appointment and get all these things checked off the list. I hardly have time to do anything for myself. But you have a solution to that. You kind of have a one-stop shop community event.
Yes, we do. We've been doing it. This is our 5th year now to really care for the women in our communities. On Friday, we're going to be doing our 5th annual Women's Heart Community event. What that is, it's a combination of educational workshops, a keynote speaker, but most importantly, it's what we're going to do is the screening. We're going to help women understand their cardiovascular risk by just coming and getting screened. It takes you an hour or even less to get your blood pressure checked, to get your lipids profile, your hemoglobin A1C. We have a card that has lipoprotein A in the information. We will not be doing that screening. And also get your mammograms done, because we talked about the whole breast cancer, the risk for the treatment for breast cancer. So that is important. I don't see where you're going to go that another day and get all those things in one place, one stop. The most important part of this is you're going to meet other women that you talk about their risk, your risk, how you can work together. You're going to hear information about diet and exercise and the calcium scores that we talked about. How can you sign up for it? Just right there. Experts are going to be there. You have questions one-on-one with the pharmacist. So it's important. We really want to see people come out because we want to be able to empower women. You give one information to one woman, the next person gets it, her neighbor, her friend, she's integrating her household. It really helps empower people.
Yeah, and how often do you get to have experts like that at your disposal like that for that length of time? I mean, you usually get to see your doctor for like 15, 20 minutes. That's it. So this is really key. Now, let me ask you this. The screenings that are offered, is fasting required or any kind of other special instructions?
Not really. All the screening that can be done, you can just take your lunch break, really. Take your lunch break, that much time. You can get there. We have parking spaces that are free. You can be able to talk. We have bus passes there. You're going to come and meet us. You're going to talk to me as a cardiologist, talk about things, meet my colleagues and other clinicians around. So that's important to be able to just, even that 30 minutes break that you have, you can come and spend it with us and change your risk for heart disease, get information that's going to help you for the future.
Yeah, speaking of information, how important is it knowing your family history with regards to heart health?
It is key. Knowing your family history is one of the single most important information that you can get, because part of those things we can, even though 80% is preventable, there are some things that we can't change, but we can help you. So let's say your father, a male first generation person in your family member had heart disease at the age, or a heart attack at the age less than 55, female less than 65. That is key for early screening. And that's where that coronary calcium score comes in. That's where knowing the numbers for your lipid profile comes in. That's where are you diabetic comes in. If family members are type 2 diabetic, it's important as well. That lipoprotein A that we talked about, we will not be screening, but we're going to have good information that's going to be provided to people how they can get the screening and what that means. You want to know that, because if it's high, your risk for heart disease is high. You want to also know that, if you're smoking, what information that you have to stop smoking as well.
Okay, well, thank you for your time and your expertise. And again, that community event is this Friday. If you've got any more questions about that, it's going to be in the To Your Wellbeing section of our website.